Hello everyone. Today we are going to discuss IAP Immunization Schedule 2021. What are the new things that we are going to discuss? As you know, there are certain differences between your NIS and IAP Immunization Schedule. Today we are going to discuss what is new in IAP. What is the recommendation as per IAP 2021? So at birth, same BCG, OPV and hepatitis B. Then at 6 weeks, Penta. Penta contains DPT, your hepatitis B and HIV. And if it contains IPV, then it is called Hexa. Hexa contains all these. Then along with the Hexa, we can give Rota first dose and PCV first dose. PCV is your pneumococcal conjugate vaccine. So Hexa, Rota and PCV to be given at 6 weeks. Then 10 weeks, same. Hexa, Rota 2 and PCV second dose. Then 14 weeks, same. Hexa. Hexa means DPT, IPV, HIV and hepatitis B. Along with that, we can give Rota third dose and PCV. PCV is your pneumococcal conjugate vaccine. You can opt either 10 or 13 valent, but we have to give at least one. PCV has to be given because it is very important, and third dose is to be given at 14 weeks. So 6, 10, 14, Hexa, Rota and PCV. Then we can call the child at 6 completed months. 6 completed months, we can give TCV. TCV is your typhoid conjugate vaccine. Then along with the typhoid conjugate vaccine, we can give influenza. Influenza first dose. As we know, previously influenza, the dose was 0.25 ml up to 6 months to 3 years. Previously we were using 0.25 ml. But recent recommendation is we can give 0.5 ml universally. After 6 months to all, we can give 0.5 ml of influenza and one dose to be repeated after 1 month. That is, at 7 months, we can call the child for second dose of influenza vaccination. Then we can call the child at 9 completed months. 9 completed months, we can give MMR. MMR, we can give at 9 completed months. Along with MMR, they are telling we can give MCV. MCV is meningococcal conjugate vaccine. Meningococcal conjugate vaccine of certain brand, that is your Menactra, can be given at 9 months. Then at 1 year we can give hepatitis A. Hepatitis A first dose. Hepatitis A booster to be given after 6 months. That is at 18 months we can give hepatitis A booster. So along with hepatitis A, we can give vaccine against Japanese encephalitis. So 13 months, 12 completed, that is after 1 year completion, we are allowed to give hepatitis A and along with that Japanese encephalitis. Then after 1 month, second dose of Japanese encephalitis to be given, that is at 13 months. Then 15 months completed, we can give MMR second dose, your PCV booster and varicella first dose. Varicella is against your chickenpox. So 16 months we can give MMR, PCV and varicella. So what is new? What is new thing is we can give the booster of varicella after 3 to 6 months of the first dose. Previously we were using varicella booster or second dose at 5 years of age, but nowadays they are telling it should preferably be given after 3 to 6 months of the first dose of varicella. That is, after 18 months we can give the second dose of varicella. Then 15 months over MMR, PCV and varicella, then we can give, then you can call the child at 6 to 18 months. So there what is to be given? There we can give DPT, your HIV booster and your IPV booster. Here no hepatitis B. This is to be remembered. No hepatitis B. Hepatitis B schedule has been completed at 14 weeks. So no need to give hepatitis B here. Then 18 months we can give hepatitis A second dose because we have given already hepatitis A at 12 months. So this is the second dose of hepatitis A to be given. Then along with hepatitis A booster, we can give varicella booster as we have already discussed. Previously at 2 years we were giving TCV, but as per recent recommendation, there is no booster for typhoid conjugate vaccine. So one dose is sufficient, which we have already given at 6 months completed. So no need to give typhoid booster at 2 years. Then next, every yearly we can call the child for vaccination for influenza vaccination. Yearly it has to be given up to 5 years we are giving usually. then we can call the patient at 5 years. At 5 years, what we were using previously? We were using DPT, we were using MMR, and we are using varicella. So varicella already it has been given. So here at 5 years, what are the things to be given? DPT, MMR. And here new thing is they have recently recommended IPV. IPV second booster to be included as per second booster, that is to be given at 5 years. So what are the things to be given at 5 years? DPT, IPV, and MMR. These are the things which we follow. We have to follow. Then 10 years. 10 years we are previously using TDAP, that is same TDAP, and along with TDAP we can give HPV against your cervical cancer in girls only. That is, the dose is from 9 years to 14 years, 2 doses, 0 and 6, from 15 years onwards, 016 or 026 as per the bivalent or quadrivalent. If you are giving bivalent cervical cancer vaccine, then 016. If you are opting quadrivalent, then 026. That is the thing which we have to remember. So schedule is to summarize: at birth, BCG, OPV, hepatitis B, 6, 10, 14, hexa, rota, and PCV, first, second, and third dose. Then 6 months completed, you can give TCV along with that influenza, 0.5 ml. After 1 month of influenza, we can give the second dose of influenza. Then yearly it has to be repeated. Then at 9 months completed, it is MMR along with that MCV to be given. Then 1 year we can give hepatitis A along with Japanese encephalitis. Then Japanese encephalitis to be repeated after 1 month. Then 15 months completed, we can give MMR, chickenpox, means varicella, and PCV. Second dose of varicella to be repeated can be given, and they are telling it should preferably be given after 3 to 6 months. Along with hepatitis A, we can give at 18 months hepatitis A plus varicella. 16 to 18 months we can give DPT, your HIV, and your IPV booster. Then no typhoid booster. Then yearly influenza vaccination. At 5 years, your DPT along with that IPV booster. This is the new thing, and along with that MMR up to 5 years. At 10 years, we can give TDAP, and along with that HPV. 9 to 14 years, it is 0 and 6. After 14 years, it is 016 or 026. These are the new things. And what we have left is your MCV. MCV, there are 2 brands. One is Menactra and another is Monbio. Your Menactra is to be given, can be given less than 2 years, 2 doses at 9 months completed and 12 months completed. 2 doses. But if you are giving Monbio, that is single dose can be given after 2 years. So these are the new things. New things is your influenza vaccination, 0.5 ml, your IPV, introduction of IPV as second booster at 4 to 6 years, and your and varicella that can be given, the booster can be given after 3 to 6 months of the first dose. Thank you.